Hi folks, Dr. Ed Beyer here at Beyer Regenerative Medicine in Tinley Park, Illinois. You know, we get hundreds of people that come to our regenerative medicine part of our clinic to regenerate broken down arthritic joints. Knee is the number one thing that we see, but we see a lot of hips, back, hands, you name it. Any type of arthritic joint can potentially benefit from stem cell therapy. So when I'm making this video, I'm going to go over 7 things that will enhance the viability and the effectiveness of stem cell therapy. But first, I kind of want to do a little bit of a review. So what do stem cells actually do? We obtain our stem cells from human umbilical cord tissue through an FDA regulated process. And these are the best stem cells to use to regenerate joint versus using your own. So there's 2 things that these stem cells are going to do. Number one, they're going to start regenerating the actual tissue that's missing from your arthritic joint. It could be cartilage, it could be ligaments, it could be bone, whatever the joint needs, these stem cells will make new cells. They don't repair the old dead and dying cells, they make new cells. That's what stem cells do. But they're also going to self-replicate. So our 1 cc of the type of stem cells that we use contain over 1 million viable live stem cells. But what they're going to do, they're going to replicate every 28 hours. So that million becomes 2 million, and 2 million becomes 4 million. Every 28 hours, up to a year, these will continue to regenerate and replicate. And then those will start to regenerate too. Now the key to successful stem cell therapy, there's a lot of people out there doing this, but they're not doing it the right way, is you want to make sure that the cells are obtained from an FDA registered regulated lab. That's very important. So if these cells are viable and they stay alive. You want to use umbilical cord stem cells because they replicate quicker than our own stem cells. You want to make sure the injection has to contain a scaffold protein called hyaluronic acid. Hyaluronic acid is in all of our stem cell injections because it acts as a mesh or a scaffold for the cells to adhere to inside the joint. And then the injections are always ultrasound guided. With the spine, we use fluoroscopy. And then there's always needs to be some follow-up exercises to obtain the range of motion in the joint. So we know that these stem cells, once they're injected, will grow and thrive if the environment is a favorable environment. The more favorable you can make the environment, the better and quicker this is going to work for you. So factor number 1 that I want to go over is intermittent fasting and caloric restriction increases stem cell proliferation. It's kind of intermittent fasting is kind of a popular thing right now for weight loss. This was a study that I found on PubMed. It says that glucose reduction or blood sugar reduction prevents the slowing down of stem cells, and it increases mitochondrial respiration in human stem cells. So that just means there's more energy for the stem cells to work. So what do we mean by intermittent fasting? This would be like eating all of your food within a 6-hour period. Most people do it between noon and 6 o'clock at night. Now there are some other benefits to intermittent fasting too. It lowers insulin, which would be a fat burner. It raises growth hormone, which will burn fat and gain muscle. Cellular repair, better gene expression. It will reduce insulin resistance, those of you who are diabetic or pre-diabetic. It reduces oxidative stress, or what we know as free radicals in the body. It's great for the brain, and it may extend your life. There's a lot of good research, solid research behind intermittent fasting. Number 2 is reducing triglycerides. Now, the triglycerides will reduce the rate of replication of the stem cells, so we really want to make sure that we can lower them. So what triglycerides are, they're kind of like a storage system for unwanted carbohydrates. They cause weight gain, they cause prediabetes, and can cause diabetes. So the best way to reduce these triglycerides is to eat good, healthy fats like fish and flax and things of that nature, or take it as a supplement, which we recommend. One product from Biotics Research called Omega 1000 is a great fish oil supplement. This will increase stem cell activity and also decrease inflammation, and these fats are good for the brain too. Factor number 3, exercise boosts stem cell activity. The goal of this is a study from the University of Illinois. The goal is to do 20 minutes of aerobic exercise every day, and your target heart rate should be 180 minus your age. 20 minutes is all we really need to do to get the benefit of exercise. Factor number 4 to help your stem cells work better is reduce sugar consumption. We know that sugar causes chronic inflammation and high glucose. Both of these will decrease stem cell longevity. And reducing sugar is reducing your sugar intake is highly advisable if you're going to spend the money on stem cells. So this is, I don't need to tell you where sugar exists, but even fruit juices and too much fruit can also raise glucose levels and interfere with stem cell activity. Number 5, you want to support healthy inflammatory pathways. So we want to avoid inflammatory foods. The foods that create the most inflammation are carbohydrates, especially grains, especially gluten. Most people will have an inflammatory reaction to gluten. So you want to reduce processed sugars, food sensitivities. We do a 96-panel food sensitivity test to see what, if someone wants it, to see what foods you may be eating that are creating inflammation. And then dairy and caffeine are big culprits too to inflammation. Number 7, or 6, there are certain supplements you can take that will enhance the effect of stem cells. Vitamin D3, resveratrol, and curcumin or turmeric are excellent supplements you can take to enhance the effect of stem cells. And then number 7 is alcohol. Alcohol is extremely inflammatory and will definitely suppress stem cell activity. I hope that helps. These are 7 things you can do on your own to promote the effectiveness of stem cells, which by themselves, in my 33 years of practice, I have never seen a therapy more effective in overcoming arthritic pain in my entire life, if you're a good candidate for it. If you like this information, please remember to like, share, and subscribe to my YouTube channel. I'm Dr. Ed Beyer. Have a great day.